Good morning, I'm Dr. Wong, a gastroenterologist specializing in disorders of the digestive system. I understand you've been having discomfort after meals, so I'd like you to tell me in detail about your symptoms, including when they started, how often they occur, and whether anything in particular seems to trigger them.
我第一次覺得胸口燒灼感大概係6個月前，但係過去2個月嚴重咗好多，幾乎每晚都會出現，特別係食完大餐，或者食辣嘢、油炸嘢，甚至飲咖啡之後，我會覺得由胃一直燒到上胸口，有時仲會延伸到喉嚨。
What you're describing is very typical of gastroesophageal reflux disease. This condition occurs when the lower esophageal sphincter, which is the muscular ring that normally prevents stomach contents from flowing back, become weakened or relaxes inappropriately, allowing gastric acid and sometimes bile to reflux into the esophagus, causing irritation, burning, and inflammation of the esophageal lining.
我夜晚瞓覺時會突然起身，口入面有酸酸嘅味，好似啲食物倒流反上嚟咁，搞到我好難再入睡，有幾次仲突然咳嗽到停唔到，應該都係胃酸引起嘅。
Nighttime symptoms are indeed concerning, because when acid reflux occurs in a lying position, the esophagus is more exposed to prolonged contact with gastric acid, which can increase the risk of complications such as esophagitis, strictures, and in chronic cases, a precancerous condition known as Barrett's esophagus.
我應唔應該擔心自己已經出現咗呢啲併發症？
To assess the extent of damage, we usually order an upper endoscopy, which allows us to directly visualize the esophageal mucosa, look for inflammation, erosions, ulcers, or Barrett's changes, and even take biopsies if necessary.
我之前從來未做過胃鏡，老實講有啲緊張，可唔可以解釋成個程序點樣做？會唔會好痛？通常會用咩麻醉或者鎮靜劑？
During an upper endoscopy, we insert a thin, flexible tube equipped with a camera through the mouth and down into the esophagus, stomach, and duodenum. Patients are typically given conscious sedation so that you remain relaxed and drowsy but still able to breathe on your own. Most people tolerate the procedure well and remember very little afterward.
如果檢查結果顯示我真係有食道炎，甚至巴雷特氏食道，下一步會點樣治療？係唔係一定要做手術定係有藥可以有效控制？
In most cases, we start with medical management rather than surgery.
呢啲藥通常有冇副作用？
Some people may experience minor side effects such as headache, diarrhea, or stomach upset. With long-term use, there can be reduced absorption of vitamins and minerals like B12, magnesium, and calcium, so we monitor that if you stay on the medicine for a long time. But overall, the benefits usually outweigh the risks.
除咗食藥之外，我嘅日常生活有冇啲嘢要改變，例如飲食、瞓覺嘅姿勢，或者做運動嘅習慣，可以幫我減少反流嘅次數？
We recommend avoiding foods and beverages that weaken the lower esophageal sphincter, such as chocolate, caffeine, alcohol, peppermint, and fatty foods. Eating smaller, more frequent meals instead of large heavy meals helps. It's also important to avoid lying down within 3 hours of eating and to elevate the head of the bed by about 6 to 8 inches to reduce nighttime reflux.
我發覺自己成日食得好夜，之後又即刻瞓低睇電視，應該令情況更差。我會試下改呢個習慣。如果我只係先靠生活習慣改善，睇下有冇用，得唔得呢？因為藥有好多副作用，定係我嘅情況已經太嚴重，唔可以單靠呢啲。
In your case, because you're having symptoms almost every day and even waking up at night with discomfort, I do recommend combining lifestyle changes with a short course of medication at the beginning. The medication will calm down the acid quickly and give your esophagus a chance to heal, while the lifestyle changes help prevent future flare-ups. Once your condition improves, we can always try reducing or even stopping the medication to see if lifestyle measures are enough on their own.
如果改變生活方式同食藥都未能完全控制症狀，仲有咩其他選擇？
If lifestyle changes and medicine doesn't bring enough relief, the next step would be surgery. But don't worry, most people respond very well to medication, and surgery is rarely needed.
可唔可以俾我啲實際例子？邊啲食物應該多食啲，邊啲要完全避免？我想清楚知道邊啲改變係真係有效。
Foods that are generally well tolerated and may even be protective include oatmeal, non-citrus fruits like bananas and melons, lean proteins such as chicken or fish, and vegetables that are not overly acidic. On the other hand, you should limit or avoid tomato-based products, citrus fruits, onions, garlic, spicy dishes, fried foods, chocolate, peppermint, alcohol, and caffeinated beverages, as these are known to trigger reflux in many patients.
我成日食番茄醬意粉，而且幾乎每日早上都飲橙汁，所以難怪我症狀咁頻密。雖然要戒掉唔容易，但如果真係有幫助，我願意試。
Remember, it doesn't always have to be all or nothing. Some patients find that reducing the frequency and portion size of these trigger foods already leads to noticeable improvement. Keeping a food diary can help you identify which items affect you most, so we can personalize your plan rather than eliminate everything at once.
我都覺得寫食物日記係好主意，因為好多時好難即刻記得邊樣食物引發症狀，特別係要幾個鐘頭先出現嘅情況。
In addition to dietary notes, it's helpful to record the timing of your meals, your body position after eating, and whether you are engaged in physical activity. All of these factors can influence reflux episodes.
夜晚成日頂住瞓唔着，你今日會開藥俾我食定係要等做完檢查先開始？
I'll prescribe the medication today so you can start right away, and at the same time we'll schedule the upper endoscopy. The medicine will help control your symptoms and protect your esophagus while we wait for the procedure, and the endoscopy will give us a clear picture of how much irritation or damage is present.
胃鏡檢查大概幾時會做？
We usually schedule it within the next few weeks, depending on availability. It isn't an emergency in your case, but we don't want to delay too long either, since you've had frequent symptoms. While you're waiting, the medication will control the acid and protect your esophagus, so you should already feel relief before the procedure.
胃鏡檢查確實幾時會安排到？
I'll have my staff check the schedule today, and you'll leave here with a confirmed appointment date.
做胃鏡之前要唔要禁食？仲有冇其他限制要注意？
Yes, you'll need to fast for at least 6 to 8 hours before the procedure. That means no food, milk, or colored liquids during that time. You may drink small sips of clear water up to 2 hours before. If you take daily medications, we'll discuss which ones to continue and which to. You should also arrange for someone to take you home afterward, since you'll receive sedation.
我依家每日朝早有食降血壓藥，夜晚有食降膽固醇藥，仲有糖尿藥。做胃鏡之前係咪全部都要停？
My nurse will go over each of your medications with you once we're done here and explain clearly which ones to continue and which ones to pause.
胃鏡大概要幾耐？做完之後幾時可以返屋企？
The procedure usually takes only about 10 to 15 minutes. Including preparation and recovery from the sedation, you'll be at the hospital for around 2 to 3 hours in total. Most patients can go home the same day once they're fully awake, but you'll need someone to accompany you since you won't be able to drive.
我幾時可以知道胃鏡檢查嘅結果？
In most cases, I can tell you the initial findings right after the procedure, once you're awake enough to understand. If we take biopsies, those results usually take about 1 to 2 weeks to come back from the lab. We'll then review everything together at your follow-up appointment.
我開始食藥之後，係唔係會好快見到改善，定係要等幾個星期先見到效果？
Most patients begin to notice improvement within a few days to a week, especially with heartburn and regurgitation. However, full healing of esophagitis may take several weeks, which is why we usually prescribe at least a 2-month course initially.
我有時會自己買啲非處方嘅制酸劑，好似 Tums， 喺燒灼感好嚴重嗰陣食。既然你而家開藥俾我食，我仲要唔要停咗 Tums？
You don't have to stop Tums completely. The prescription medicine will be your main treatment, but if you have breakthrough symptoms, it's safe to take an occasional Tums for quick relief. Just don't rely on them every day since the other medicine will be doing the long-term work.
咖啡係唔係要完全戒定係少少冇問題？
Caffeine often makes reflux worse, but some people tolerate a small amount. For now, I'd recommend cutting it out for a few weeks to see if your symptoms improve. Later, we can reintroduce a small cup and check whether it triggers problems for you.
等我總結一下，你今日會開藥俾我，我即刻開始食，同時我會改變生活習慣，好似少食多餐，唔好夜晚食宵夜，仲有瞓覺將頭抬高。前台會喺我走之前俾我一個確實嘅胃鏡檢查日期。我知道檢查前唔可以食嘢至少6至8個鐘頭，仲可以飲清水到檢查前2個鐘。護士會俾我書面指引，話俾我聽邊啲日常藥要照食，邊啲要暫停。做完胃鏡之後，我會同你一齊覆診睇報告，係唔係？
You really have a good memory. Yes, the front desk will finalize your appointment date today, and the nurse will review all of your prep instructions with you before you leave. Starting the medication now and making those lifestyle adjustments will already help you feel better while you're waiting for the procedure. After the endoscopy, we'll sit down together to go over the findings and decide on the next steps. You're doing a great job taking charge of your health.
多謝醫生，我會盡力跟足所有建議。再次多謝你花咁多時間詳細解釋。
Wait here, the nurse will come in shortly to give you the instructions, and she speaks Cantonese.